So what are the risk factors for getting prostate cancer, and how can you minimize your risk of dying for prostate cancer? Hi, I'm Dr. Kenneth, a board-certified urologist practicing in South Carolina. I use this channel to educate my audience on issues relevant to urology and men's health. If you enjoy what you see today, please like and subscribe and turn on notifications so that you can see future content as it is released. So let's talk a little bit about prostate cancer. 1 in 8 American men will be diagnosed with prostate cancer during their lifetime. It is the most common non-skin cancer in American men, and it is the second leading cause of cancer death in American men. The trouble with prostate cancer, it is difficult to sometimes tell which cancers would affect a man during their lifetime and which would not. We know that some prostate cancers would not cause death in most men, while others are much more aggressive and have a significant chance of spreading and potentially being lethal. So what are the risk factors for prostate cancer? Here we will review some of the most common and talk about what can be modified and what cannot. Number 1, age is a huge risk factor for prostate cancer. This cancer rarely occurs in men less than 40 years old. For this reason, very few guidelines would recommend getting a PSA in a man less than age 40, except in very unusual circumstances. Prostate cancer becomes more common as we age, and in fact, 80% of prostate cancers will be diagnosed between the ages of 45 and 74. So while you can't modify, you do need to get screened at an appropriate age. The second is genetics and family history. Having a first-degree male relative with prostate cancer, a brother or father, more than doubles your risk of having prostate cancer. Having more than one first-degree relative who is affected by prostate cancer increases the risk even more. It seems that hereditary or genetic prostate cancers account for approximately 10% of prostate cancers overall. Sometimes specific genes are causing prostate cancer. This is true of the BRCA1 and BRCA2 genes, which are sometimes called BRCA, and can cause breast or ovarian cancer. Men from affected families should speak with their physician and potentially a genetic counselor. There are other specific genes which can cause prostate cancer as well. These include the HOXB13 and MSH2 gene, which causes Lynch syndrome. Lifestyle factors matter as well. Obesity is a risk factor for prostate cancer and getting more aggressive prostate cancer. This is probably due to increased inflammation and insulin secretion, which can cause the development of tumors in the prostate. Other dietary factors which seem to matter include the consumption of a large amount of fried food and saturated fats. These also likely increase the risk by causing inflammation. Some foods do seem to be protective, like lycopene, which is a pigment which comes from tomatoes. Bottom line is that a low inflammation diet rich in fruits and vegetables will probably reduce your risk of prostate cancer. The impact of smoking on prostate cancer is somewhat controversial. Some studies have shown that men who smoke cigarettes may have a lower chance of being diagnosed with prostate cancer, but this is likely due to the fact that men who smoke are less likely to get screened for prostate cancer. Other studies seem to suggest that smokers have a higher risk of lethal or aggressive prostate cancer. So for this reason, if you smoke, you should attempt to quit to lower your risk of prostate cancer. Although it does seem that African American men are more likely to have prostate cancer at an earlier age, and many men recommend that African American men should start screening earlier than Caucasian men. Whether these differences are due to genetics, environment, or socioeconomic factors is a little bit difficult to tell, but it certainly seems that there is an impact on access to screening and treatment in certain situations. The bottom line is that there are disparities in prostate cancer outcomes depending on race, and we should consider urging African American men to screen earlier and screen consistently. So while you can't change your genetics, you can lead a healthy lifestyle with respect to smoking cessation, keeping your weight under control, and enjoying a balanced diet. Bottom line is that foods and activities which are good for your overall health likely reduce your risk of prostate cancer. No matter what your risk, you should be sure that you are actively engaged in discussions with your physician about screening for prostate cancer. Screening can involve getting a PSA, which is a blood test, and doing a digital rectal exam where the prostate is felt. These tests can be done every 1 to 2 years. Screening gives you the best chance of catching a prostate cancer early and reducing your risk of dying from prostate cancer. Once again, I hope this content was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released. Thanks for watching.